oncology is the art of medicine, basically, because you have your guidelines, you have your knowledge, but the way I look at managing patients with cancer, I look at it as a triangle, okay? At the top of that triangle is the patient. Every patient is different in their phase of life and their goals of life and what can tolerate and what cannot tolerate. So this patient is very unique to this. So a 40-year-old with a triple negative breast cancer that has a kid that is 5 years old, their goals in life is going to be completely different than 75 years or 85 years old with triple negative that have lived their life to the fullest. Sure. So that's at the top of the triangle. The other angle of that is me as an oncologist, with my knowledge, my experience, and my experience in life. Because I come to this with 14, 15 years of experience on internal medicine before that. That's make a huge difference in the sense of you're comfortable with having discussion. You're comfortable with managing other noise of other hypertension and all of that. Cancer is the third angle of that triangle. And cancer, you have to think of it as it has its own mind. Because the way the cancer is evolving, it evolves like anything else. So you start with a certain reason that you have this cell to go rogue. That cell went rogue because you have a mutation, or it has an environmental stress like smoking causing a mutation, or exposure, or just a random act of evilness. That cancer, but then you start treating the cancer and then it evolves with time on what is the driver, what is driving this cell now to become unresponsive to the treatment. So if you keep looking at managing the patient within that triangle of me, patient, and the cancer, then you have to have art to manage all of that together. Because you have to make a decision based on what does the patient want, how is the cancer behaving, what is my comfort level. Because sometimes we use drugs that we never used before. Like there's always a first time for drugs that was approved last week.
Right.
So